Welcome back. As we mentioned, Alabama and states all across the nation now seeing a recent spike in coronavirus cases. We're joined now by Dr. Ali Hassoun, an infectious disease specialist at Huntsville Hospital, to discuss this recent increase. Thanks for joining us again, Dr. Hassoun.
For having me.
We have talked to you, of course, a number of times. I feel pretty confident in saying you're probably not surprised by this increase.
Not at all. You know, and I can tell you it's now very concerning because we've seen significant increase in our area in addition to the other counties as well as the whole state of Alabama. The main concern with that is it seems I know people are fatigued, frustrated about the physical distancing and masking and other things, but that's what's important so we can get over this together and avoid people dying or avoid people getting into the hospital very sick and its associated problem.
Yeah, this is especially concerning. We've reported that experts have said this rise is not just because of more testing. These are actually more people getting sick. Is that true?
Absolutely, yeah. I mean, we're seeing increased admission to the hospital for people with different symptoms, but some of them are extremely sick with COVID-19. So it's not only positive tests, it's not only testing that have increased. We definitely, the admission rate and its associated issues have increased significantly.
Now, we were told at the outset that, you know, this is all about flattening the curve, reducing the risk of overwhelming hospitals. Are we at risk of maybe going back in that direction?
So then my belief is we really never reached that flattening the curve well in the surrounding counties and the state of Alabama. And what happened, we never finished the first wave. And now we're seeing the peak of that first wave that's increasing at the moment, unfortunately, rather than it was in March or April, because in March and April, we were able to control some with the lockdown. Now with everything reopened, I think we're going to see the real peak, unfortunately.
Yeah. What do we do to curb this?
I think we go back to the basics of prevention. It's really social distancing, physical distancing as much as you can. Now we reopen, whether restaurants, schools, workplaces, we're gonna need to look into physical distancing. Mask, add to it when you are in close contact, when you're for a longer duration, but the physical distancing is really important. So avoid big gathering, avoid going out to the beaches in big group. If you go in a family, might be okay, avoiding contact with others, but really this big gathering and all together, it's a major problem.
What do you think can be done about this coronavirus quarantine fatigue? You mentioned this a minute ago, but you can't really ask people to go, or can you, go back inside, close businesses again, lock down the economy? The president said that's not going to happen.
Yeah, so the reality is every country, and the best example is, for example, New Zealand, who was successful in doing it, was a strict lockdown, flattening the curve and reduction in cases significantly over 2 weeks, and then reopening slowly. We cannot do that, then we're going to need to do at least physical distancing and looking at other ways if we can. But the threat will be we might end up need to do the lockdown again.
The governor has said it's up to us now to do the right thing, and obviously that's not happening everywhere. Should governments try to enforce, for instance, wearing a mask? Or maybe this is out of your lane, but how can local governments expect to push any measures when they seem to endorse these protests that we've seen over the last several weeks?
Yeah, I mean, that will be extremely difficult to be enforced. You know, I think part of it is putting, for example, if there is any big gathering, those in close contact, they don't put masks, or those in where they don't follow the physical distancing part, and it might be talking about fines to start with and talk about it. I can tell you it's difficult to implement and enforce. Like the mayor said, it's personal responsibility, but it might be we need to go to churches and mosques and synagogues. We need to go to places of, you know, where employee and schools and give more education. Sit and talk what's their problems, why they don't do it, how we can help with that. Leadership push for it more and more. it might be we need to rethink that process a little bit more.
Let's end on a positive note, hopefully. When does this end? What's the latest on drug therapies and a vaccine?
Yeah, unfortunately, there is none yet as an antiviral medicine is very promising. You heard about the dexamethasone study from England that showed benefit, but I need to emphasize the dexamethasone is not antiviral. It's more if the patient gets really sick, it might help to reduce inflammation. And we don't want patients to get into that stage. We want to prevent it much early. So at the moment, there's really no magic bullet for this at all.
Dr. Ali Hassoun, appreciate your insight again. Thanks for joining us.
Thank you.